Our union, SEIU, has a proud history of fighting for social justice. 10 years ago, SEIU gave birth to a new union of, by, and for caregivers, SEIU Healthcare 775 Northwest. In the 1980s, home care workers in Illinois and California decided they would be invisible no more. They set out to fight to change our system with advocates to win for workers.
We could not fight for our rights at the expense of those who are still getting dirt poor wages.
The path to making this change was through building a union. In 1999, nearly 75,000 home care workers in Los Angeles won the right to form a union.
Here we go.
In Washington state, we started with a voter initiative in 2001, which led to huge union elections in 2002.
A qualified home care worker will enable an elderly person to live in his or her home.
Vote yes on I-775, the Quality Home Care Initiative.
Initiative 775 passed with a 63% yes vote and passed in every county in the state. Caregivers and clients were mobilizing in their communities and in the state capitol, while home care workers prepared to vote to join SEIU.
It was a brand new movement being born, as for the first time, home care workers in purple shirts marched on the Capitol and spoke in legislative hearings and gave testimony.
About 26,000 home caregivers will decide if they're going to join the Service Employees International Union.
Starting today, home care workers are invisible no more. We fight to save our long-term care system, to win dignity and respect for caregivers.
We won. We have a voice.
After individual providers voted 84% to join SEIU, we had to fight to win our first contract.
Through that first contract fight over a period of 2 years, home care workers and their allies contacted legislators 50,000 times that we can count. Phone calls, faxes, letters, and emails we saw copies of, postcards that we mailed in. 50,000 contacts between home care workers and legislators. That's accountability.
After more than 18 months of negotiations, 2,300 home healthcare workers in Spokane have something to celebrate.
In that first union contract, we set national standards for affordable health care and workers' compensation coverage. We used our new strength to organize home care agencies. We began work on public policy issues, defending Medicaid and pushing for professional training. We continued to make alliances with consumers and advocates, and we organized the largest home care agency in Montana.
It's not a victory for only ourselves, but it's a victory for our clients to be able to have the quality of care that they deserve.
We improved funding for nursing homes by nearly $20 million and organized 25 homes over 2 years in the largest union campaign in North America. While we won a voice for nursing home workers in union facilities and developed our own voice at the legislature, most nursing home workers are still not union, and the vast majority do not have health insurance.
How come it was important for you to be here at Nursing Home Lobby Day today?
To get more money for the staff and the residents. If we don't have the money, we don't have the staff. If we don't have the staff, then there's no care for the residents.
Our vision is of an economy, and our vision of a society is one where what happens to seniors and people with disabilities who are in the frailest moments of their life matters not just to them, but to everybody.
Our seniors are people with physical and developmental disabilities. They all deserve to live in a happy, healthy home.
We are now a strong and respected voice in Olympia and beyond. Caregivers are pushing legislators to face the crisis in long-term care, advocating for improved training for home care workers and safe staffing for nursing homes.
We march and rally, and then we go visit with our legislators.
If I was a hairdresser, it takes 1,000 hours of education.
Mm-hmm.
If I wanted to be a manicurist, it's 600 hours of education. For me, to be a home care worker is 32 hours.
Mm-hmm.
We are also beginning to build a strong voice for nursing home workers. We're very aware that 10,000 baby boomers retire every day. We must fight for quality care options, and voters agree. In November 2008, Washington voters approved Initiative 1029. More than 2 million voters supported improved training for in-home caregivers.
people are out of work and can't find jobs. 5 million people have lost their homes to foreclosure. And it is the greatest income inequality since the Great Depression.
As our national economy continues to limp along, corporate profits are up, long-term care and human services are being cut, and working families are being forced to pay for the mess.
Despite $14 billion in worldwide profits, General Electric is paying no federal taxes.
There's a new report out today, and it shows a widening gap between the rich and the poor.
35 states have gaping budget shortfalls.
The cuts proposed in this budget are deep and widespread.
To balance the state budget, the agency will cut spending on long-term care programs by $40 million.
In the final budget deal, the 2011 legislature voted to suspend voter-approved Initiative 1029. Our union quickly mobilized to qualify Initiative 1163 for the November 2011 election to reinstate training standards for in-home caregivers. Now we're educating ourselves about who broke the economy and how we're going to fix it.
This is not an accident. This is not the result of some mysterious confluence of forces beyond our understanding. It's because the greediest 1% of Americans decided that they needed to bust the labor movement and destroy government and the public sector.
In the face of this all-out assault on working families and the services we provide, we unleashed our moral outrage and fought back.
Seniors, people with disabilities, and their caregivers demonstrated at 6 locations, including Seattle today.
We have clients that cannot get up in the morning until we walk through the front door. They are in their beds waiting for us to walk through the front door.
Instead of a legislative hearing, they called it a people's hearing. Social service clients and the workers who care for them speaking out to preserve the state aid that has become their lifeline.
We want justice! When do we want it? Now! When do we want quality care? When do we want it? Now!
Healthcare providers interrupted the House of Representatives with outbursts of violation of state law.
People speak up for the disabled and elderly.
It is not just, it is not moral, it is not ethical, it is not right to ask from those who earn the least, who work the hardest, who did absolutely nothing to cause this economic mess, that we should somehow finance the state's way out of it.
Now, union caregivers are leading the fight for a fair economy for all of us.
Protesters say they're upset to see the state make major cuts to social services for seniors, patients, and people with disabilities, while big business and Wall Street continue to receive bailout after bailout and other perks.
I was given a social contract. Work hard. Go to school. You'll have financial success. I've done my job. I've kept my part of the deal. Where are the good jobs?
Our union is about improving the lives of workers and their families and leading the way towards social and economic justice. And we can never forget that at the end of the day, we are a justice movement.